In addition to many genes known which play a role in type 1 diabetes, there are also a number of environmental factors which are thought to contribute, such as viruses. It is known that a number of viruses can infect and lyse the beta cells of the pancreas, which produce insulin, including a number of enteroviruses, such as the Coxsackie virus, and the mumps and rubella viruses. There are a number of lines of evidence suggesting that viruses have a role in type 1 diabetes. The increase in the cases of diabetes during a year coincides with the winter months when viruses are more common. Rises in the incidence of diabetes can sometimes coincide with outbreaks of enterovirus. Children with enterovirus infections have a slightly higher increased risk of developing type 1 diabetes. Diabetes patients have a higher rate of infection by the Epstein-Barr virus than do those who do not have diabetes. Animal studies have shown that viral infections can cause diabetes, and viral DNA has been isolated from the islets of some recently diagnosed patients with diabetes. Viruses could have a number of effects on the beta cells of the islets of Langerhans. They could cause them to burst. Obviously, that could ultimately lead in the loss of these cells and the inability to produce insulin. They could cause beta cells to change their gene expression and thus perhaps increase the likelihood that autoantibodies would be raised against them, or increase the production of inflammatory cytokines, which would attract additional white blood cells to the islets of Langerhans. Also, as antigen-presenting cells perform phagocytosis of virally infected cells or the debris of burst cells, they could not only present viral antigens to lymphocytes, but also antigens derived from the infected beta cells. This could cause the lymphocytes to mistake the antigens from the host beta cells as associated with the foreign virus and to mount an autoimmune attack against them.